Yeah, if that's okay. If everybody will comment in the chat your name and your organization. That way that we can be recorded who all was here today. And I'll remind everybody a few times just to make sure everyone does that. Okay. So just quickly to get us started, it's 12:03, so I feel like everybody is here. They can log in a little late, but we're just gonna kind of go review our committees and see if there's anything to report. We've only had our one meeting, so some of our committees have gotten started. And Dolly is not here yet, so she's committee chair A's lead. Is somebody from committee A want to speak, or do we want to wait on Dolly a few minutes?
Let's wait on her for a second, and maybe Dr. DeLucia can kick us off.
What did I miss? I went to get my soup. What did you say, Emily?
Would you want to give just any brief updates on our committee C, since you are our chair?
I was going to say I've been derelict in my duties as far as getting us together, but I think there's been a lot of work in the background on the assessment, because there's so much that we can do with three kind of high profile kinds of things, distilling down to one. We've got the Tennessee Together really being the nexus of the opioid problem and response in Tennessee. And, so vital that we coordinated our efforts, not only with what's going on across the state, but across the nation. So that's why I think we need to be strategic and divvy up into some actionable items. Jillian was so kind as to send the a plan developed by the students at ETSU, which included a logic model, which included the old needs assessment. Those were two of the things that we mentioned before, and those can go out for analysis. So we don't have to reinvent the wheel, but if we want to put things on, as I put in quotes, steroids, unquote, to put our brain power behind them, I think it's great. I'm going to meet with Dr. Michael Might tomorrow, and I've included a link to what his organization with the center at the University of Chicago was doing on rural health, because that's the site of where a lot of the opioid problems have been. I'll come back charged up on that after meeting with him. And I think we can disseminate that across our group and begin actionable items for next month for sure. And Jillian suggested that we get someone from the state working to educate us. Hopefully with Zoom, what you can do is have a meeting, record it, and then anybody that misses the meeting, you got it if you want to look at it. Emily, that's what I have to report.
Thank you so much. That was for our assessment committee, Committee C. For Committee B, there was not a chair selected yet. Is there anyone that from Committee B that would like to speak up or give us an update?
So I'm going to hop on that committee today and hopefully help just get some stuff on paper a little bit more, maybe. I think that committee is so broad, and there are so many opportunities with that committee that we just need some I don't know, some like narrowing the focus maybe a little bit on that one. So I'm gonna hop on there today and hopefully help kind of narrow some things down. I really feel like that committee will turn into several subcommittees of folks with different interests. But we hopefully today will be able to kind of figure that out. Dolly's mom is in the hospital, and so I'm hoping she's able to get on. But if we want to keep moving and check back in with her when she gets on, we can.
Sure, we can do that. Okay, hopefully everyone was able to get our community calendar or any like community update link where you submit any forms to turn in, just so we can see any needs in our community or what's going on. Those are included, they're attached to the agenda for each meeting, so you have those to review. Are there any questions about any of the things submitted for this meeting, or anything that anybody wants to add for our community calendar?
I'm showing you on the screen, but I also put the link to it in the chat box. So if you want to look at it in your own time and not have to follow my sporadicness, I don't know if that's a word, but that's what we're calling it. So it's in the chat for you as well.
I do have one event that I did not add in time for the agenda. We didn't have all the details worked out, but I'm Alana with Holston Habitat for Humanity. We did share that we're going to be having a kind of a kickoff event for a house being built. But actually prior to that event, 2 days prior, on February 11th at 5:30, that's a Thursday, next Thursday at 5:30, we're going to be having a Zoom meeting, an information meeting about this project. And we are inviting churches, businesses, organizations from Elizabethton who might be interested in participating on the project, whether it's just coming out for a day of service, like a team building day, or if there's a group that might want to sponsor a week of the project, or a group that maybe wants to help provide meals, lunches for the volunteers one day. We're going to be sharing lots of information about that at that meeting. So if you are interested, we're just asking that you contact our volunteer manager, and her email address is volunteer@holstonhabitat.org. And so you can just send her an email saying that you're interested in the meeting, and she will make sure that the Zoom link is sent to you. Thank you.
Thank you, Alana. Are there any other comments or questions about our community calendar or community needs? Okay, if not, I believe a week before or 2 weeks before each meeting, we send that out for you to submit for the next meeting, so that we can make sure everybody, organizations are getting their needs and their events out there. We're a little bit ahead of schedule because we haven't done the Committee A update, but we can go ahead and do our sharing session for this meeting. This meeting we have Mr. Rob Burke. He's with the Tennessee Department of Intellectual and Development Disabilities. He's going to talk to us about the Katie Beckett program, and I believe I saw you on there, Rob.
Yes,
there you are.
I am here. So thank you for having me. I'm filling in for my partner, Jennifer, who's feeling a bit under the weather. So you may have seen her in some of these meetings. So sorry if I'm a new face and you get a new guy telling you about a new program, but all new stuff today. So I just want to talk briefly about the Katie Beckett program. Just kind of give you a bit of an overview. We have this really long PowerPoint that's like 34, 36 pages long. That really gets into a lot of the details, but I just don't think that that's necessary at this point, because we're going to talk, well, number one, I don't think I have enough time to go through all that, regardless of how ahead of schedule we may be. And also, I think it's just helpful at first to give a brief overview and then open the floor for any questions if you have any, and then I can send out whatever information. Since I don't believe I have anyone's email here, I can send it out to Erin and she can pass it along to you guys. So the Katie Beckett program is a program that is designed for children with intellectual and or developmental disabilities, or children with complex medical needs that do not meet the criteria for Medicaid rather, TennCare, due to their families, assets or income. So a lot of time these families might fall through the cracks a bit, because since they don't meet the criteria for TennCare. Their family obviously has to have the private insurance, which only pays for so much. And depending on the needs of the child, it can be exorbitant cost to take care of their child. So we are hoping that this program will be in a position to keep children at home with their families, and allow parents and caretakers to care for their children and offset a little bit of those costs to take on a little bit of that burden for them. So there are two parts to our program, the primary parts. Part A is designed for children with those most significant, most severe needs that we are looking to assist that family the best way that we can. And if so, that these are children that would typically be, or at least be eligible for institutionalized care. But again, the family's interested in keeping them at home. So just supporting them in that. So that program looks like, if approved for the program, they would get $15,000 a year to assist in all types of different services, all kinds of things, whether that be supports specific to anything that insurance would not pay for, to cover any of those things. So, and they would get full Medicaid services through TennCare. So that would, of course, offset a lot of those costs as well. Part B is kind of the bigger piece of what we're doing, as this is designed for children that have what we would call less severe. I like to do the air quotes because who's to say what's more severe or less. However, less severe, that they would not necessarily be eligible for institutionalized care, but there's still a need there for the family. So that is a Medicaid diversion program. So the child would not get TennCare, but instead would get $10,000 a year towards a lot of the same things to help offset those costs for the family. So what that would look like, just to give you an idea, and I've got, like I said, I'll send some information over to Aaron so you guys have some good contact information, have the website, know how to make these referrals, help families make referrals or send them our way. So they would obviously apply for the program. Once that occurs, it would come to an intake case manager. We would do an assessment to kind of help figure out where they would land on whether they would meet criteria for Part B or if they would trigger for Part A. If they triggered for Part A, we would then do another assessment that was more focused and more detailed on that specific need for the child. And then following that, they would then get case management services, depending, again, if it's Part A or Part B, that will look a little bit different, but they will get that case management services to help them determine how to distribute those funds, how to allocate those funds for the best use of the family, best needs, the needs that the family has, and that to best support that child. So that's kind of in a nutshell of what the Katie Beckett program is and looks like, and what we hope to achieve in that process and in this program. So again, really the biggest things to look for is children with intellectual, developmental, or complex medical needs that do not meet criteria for TennCare, Medicaid. Tell those families to just apply, and we'll kind of help the families guide through that process to see where they may be eligible and may qualify. So if there's any questions, I'm happy to kind of take those on and kind of chat with you guys a little more specifically about the program if you have any.
Yeah, this is Tony DeLucia. Could you give a couple of examples of cases where you might give us a family or two or three or four of who gets your services? The reason being, it helps to, if you think in terms of the big picture, where your services are going. And I'll explain later on when we do some more sharing why I think this fits into
Sure.
what you're saying.
Absolutely. So any intellectual, developmental, medical type diagnoses are eligible to apply, of course. So some of specific examples, I was working with a family that has their own business. So they're self-employed, has their own private insurance. They're paying just for the child over $400 a month in insurance premiums just for the child. That's obviously quite a cost. They don't meet eligibility for 10 care, obviously with their income. So a big thing that they're looking to have assistance with is to offset those costs of those premiums. That's one of the ways that they can allocate those funds, is to offset those costs, and we can reimburse a family for their insurance premiums for the child, not for the entire family, but for the child's portion. So that's one example.
What kind of disabilities are you spanning? And give me some specific examples of some family disability child issues.
Sure. We've seen, and that specific example that I was speaking of, child had cerebral palsy, several children have genetic disorders, medical needs, maybe they have feeding tubes, they have the tracheostomy, oxygen administration, things like that. A lot of these children are going through multiple therapies each week, whether that's physical, occupational, speech therapies, obviously have IEPs in place. So that's kind of an idea of what the children are facing now. As far as diagnosis, any diagnoses, any at all. Now, if it's just like a behavioral type of diagnosis, like we would need an actual intellectual, developmental, or complex medical need diagnosis on top of that. However, any diagnosis practically is going to suffice. There's no limitation as far as that's concerned. So I know I'm answering that very broadly, but I also don't want to create an idea that this is the box of children that we're serving, and it's only children with these diagnoses or these medical or intellectual developmental needs, when that's not the case at all.
Well, actually, I was getting into like NAS or something like that, where a child could be severely behind the curve with something that has had a legal repercussion, and yet we're trying to do a lot of work now in this regard with bringing the mother and the child back into the good graces of society writ large, rather than treating them as outcasts. Maybe not the mother. Well, yes, hopefully.
Absolutely.
Okay, well.
Well, and I think in those situations, from at least what I've seen in my experience, a lot of those children are on 10 care, for whatever reason. Certainly not all, but I would say the vast majority of those children that are NAS are on 10 care. So then, of course, they wouldn't be eligible for the program. But if they don't have if the family has such assets in a way that they are not eligible for 10 care, I would say that I've not seen NAS specifically as a diagnosis that we have been, or I'm going to guess that we would probably use the diagnosis of developmental delay to capture that.
Thank you.
You're welcome. Hope that answers the question. Any other questions? If not, I will send information over to Erin, and she can certainly send it out to you guys. And if you have any questions from there, she knows how to reach me. Or like I said, Jennifer, I know typically attends these meetings for you guys, and she's happy to answer those questions as well when you guys get back together. Thank you.
Thank you so much. And yeah, we'll include all that information that you send to Erin in our minutes when we send them out for this meeting. Before we move on, I think Julian has made a few comments I think there is a link to a sign-in sheet if it to sign in on. And also she said, if you have not chosen a committee or want something different than last time, to let her know, whether in the chat with everyone or just a personal chat to Julian, so that she's preparing for in a few minutes when we split into our groups, we're going to do a breakout session. So just be aware of that, or message Julian if you need to be in a committee. We'll go ahead and move on. So we have another speaker for a few minutes. Miss Joey Ondrake. Sorry, I don't know if I'm saying your last name correctly. Yes, okay, I see you just popped up.
Yep.
She is from Frontier Health Family Links Respite. So if you want to go ahead and take it away.
Hey everybody, I actually tie in really well with Rob's information. I am with Frontier Health for Family Links Respite, and we provide respite care for children with a mental health diagnosis. They are ages 2 to 15. And basically we meet with the families for once a week and have a lot of fun with the kiddos. So the parents get a break, the kids get a break. It is a completely free program, and we have a lot of openings right now. So I am looking for some referrals, and I'm putting my info in the, oops, how'd I do that? I'm putting my info in the chat box for an email and a phone number. And again, this is completely free to our families. Some examples of some qualifying diagnoses would be ADHD, anxiety, up to the more severe like bipolar and other issues, but they don't have to be super severe. So if you just know that ADHD kiddo that is driving their parents nuts right now with all the COVID and homeschooling, we do pretty normal hours. We only go till about 6:30 at night, but once COVID's over, we can pick them up after school, bring them here for a while. We serve 4 counties. We serve Carter, Washington, Unicoi, and Sullivan. So this isn't just for the Carter County kids. That is about it. Just kind of a general kind of plea for kiddos and referrals. And like I said, I'll put my info in the chat if anyone needs more information.
Thank you so much. Does anyone have any questions for Joey? And she just shared her number and email in the chat. Thank you. If we want to move on and see, I think some more people have joined us. We skipped over the Committee A update. I think I see Dolly's name, but she might be busy to do an update.
I think Dolly's here. Dolly, can you update on Committee A? Maybe. Dolly, we need an update on Committee A.
All right. Okay. Sorry, y'all. Thank you for holding the I'm trying to nurse situation
Can
in
you
here.
bring us some blue pads and some washcloths?
So hi, and the update from Committee A is since we last met, we have somebody had made us some graphics for National Victims' Right Awareness Weeks. We've kind of got those graphics ready to go and share for all of our social media pages and so on. I have also created a magazine outline because we're going to work on putting together a CCC collaborative quarterly magazine. That's something that we're in the works of doing. And so that outline has been created and sent to each of the committee members. And so we're going to chat more about that today. Thank you.
Thank you. Hey, Julian, could you, for people who maybe weren't here or forgot, could you just go over what each committee is?
Absolutely. So let me, well, I don't have to pull it up. I'll just talk. Committee A is substance abuse, mental health focused. Committee B will be kind of we rolled in a lot of things from CAB and a lot of things action-wise into that committee. So I'm I'm not even completely sure what that's going to look like at this moment, but I think today we'll kind of narrow it down a little bit further into some subcommittees. But that's where everything like food drives, the Christmas events that CAB did, our Carter County Drug Prevention, ACEs subcommittee, all of that will be rolled into that Committee B. And then Committee C is our data collection committee. So looking at needs assessments, looking at community needs, collecting data, however that needs to be done, focusing on things like making sure our county has representation and things like Tennessee Together survey. And I'm sure things that I can't even put into words that they're gonna come up with Dr. DeLucia as their chair. So that's kind of a quick overview of the three committees. And know like these are still kind of forming too. So if you tried something last month and were like, this is not my place, like please feel free to try a different one or try something today. This is a fluid membership in these committees. So if you love Committee A, but then at Christmas you just really want to do that fun Committee B stuff, like you're welcome to kind of go throughout the committees as you need to or as you want to. I don't right now have a committee. I'm going to tell you who I'm missing here. Miss Martinez, I'm not sure. I have a committee for you. Lexi Gillert, I don't have a committee for. And then Rob, if you want to participate, let me know that as well. And then Melissa Tucker, I don't think I have a committee for. So if you all will send me in the chat where you would like to be, I will make sure you get in that breakout room.
Yes, I believe we're pretty much ready to move into our committee breakout sessions if everyone will just message where they'd like to go. So today, for the role of the chair, what we were going to discuss, well, for Committee B, we need to choose our chairs and create goals and action items for the committee and update our worksheet. And if you have your agenda pulled up, we have the form, I believe. Is that form linked on there, I think?
Yes.
Update.
And I only need your committee. If you have a committee already, you don't have to tell me what it is in the chat. I just need them if I don't know where to put you.
Jane, help.
Hey, Tony, can you hear me?
Yeah, where are these forms?
I'll look for them.
Okay.
Yeah. And then for the future, the way we're going to try to do it, like we kind of just gave an update and ask our chairs to give a brief update, but we do have a agenda monthly updating on committee process form that we're creating. So hopefully as we are kind of get our committees established and get our goals, we're going to be able to kind of fill that form out so we can have a more organized update each meeting at the beginning of all of our meetings to open up with. But we're just getting started. So we're going to move along with that. And then we also can, each committee can decide if they're wanting to meet, additionally on their own in between our meetings. But I think if you're ready, Julian, we can go ahead and meet with our committees, and we're going to do the breakout sessions in Zoom like we did last time.
So a few people that I still aren't sure where to put. So when I assign the breakout rooms, everybody will just want to click accept that invitation, and you'll magically go into your rooms. Zoom magic is awesome. And if you're still hanging out here with me, we'll decide where to put you and go from there. You don't have to remember where you asked to be. I've got lots of questions like, I don't know where I'm supposed to be. I remember for you. And the way that I remember that is through our membership form. So I'm going to put that in the chat too, and I'll put it, I think it'll stay there after we come back from breakout rooms, but just in case it doesn't, I'll put it again. But that's where you tell us which committee you want to be on. So if you haven't done that, if you'll make sure and fill out a form for us so we know. All right, y'all ready? Here we go.
I'm ready.
Hey, I wasn't going to sign up for a committee as I was just volunteering this time here, and I don't know how often I'll be here. So if it turns out that I'm here a lot, then certainly, but I didn't know how helpful that would be. So that's why I didn't want to do that right now. So, so I'll probably just hop off, but I appreciate you guys allowing me to chat, and I'll send those things to Erin right now.
Yep, thanks for being here.
All right, thank you.
All right. So y'all tell me where you want to be. Catalina.
Okay. Julian, is there any need for reporting out now, or are we just going to have everybody, if we can, submit our form for the next meeting report out and kind of communicate within your own committees if there are going to be any meetings in between our next meeting?
If we want to maybe share just a very quick recap of any progress that you all made in committees today, or any updates you want to share, or particularly anything that you would like the full committee to help you with, if there's something immediate that you're working on and could use support of the full committee with. Let's see, we can start with A, if Dolly wants to update.
Yep, I'm here, sorry. Okay, so today we just talked about kind of a recap of last month's meeting and some of the progress that we're making and on the different things, just to catch everybody up on that. We also decided to take on 2 new things. So Emma and I are going to be working on promoting the SAD blog post contest, kind of getting that out and seeing if anybody wants to participate in that. We are also going to be doing kind of this whole wraparound. It's very broad, but a mental health awareness thing, focusing on suicide and COVID-19 and being isolated, focusing on suicide awareness, suicide prevention, and also decreasing the stigma on that. So we're just gonna go ahead and work on maybe some TikTok videos as well, push some things out there, and get working on that. We also looked over, made sure everybody understood kind of a Google Drive thing. I don't think any of y'all care about this, but we're going to start working on that magazine and collaborating. We're using Google Drive to collaborate in case anybody else wants any ideas on how to collaborate outside of meetings. That's what we're going to be doing. So that's what I've got. Does anybody in my group want to add anything, or did I miss anything? Nope. Okay. That's it.
Awesome, thank you. So committee B, we worked just a little bit on narrowing down the focus of that committee today. And so I will let Dr. McCook and Shannon just share maybe the subcommittees, I guess is what they are, that we landed on, so that people kind of know where we are.
Julia, could you share your screen with the notes we came up with?
Yes, ma'am.
That would be great.
I can. Maybe I can.
So Group A was pretty hard to follow. I don't know that we did as much as Group A was able to do. We don't have necessarily a method yet. But I will come up with something and send emails to everyone to invite them. But we essentially broke it down into 3 areas: the environment, ACEs and trauma. No, oh, sorry, wrong me. Okay, let's try this again. We are going to be doing ACEs and trauma. We identified a couple of things that are coming up. One of which is April is Sexual Assault Awareness Month. And that is when we're going to be rolling out Start by Believing campaign. And our goals are to help educate the community about trauma and informed practice, ACEs and trauma, violence prevention, and we're going to be working with peak mentors. So I would love, let's see, let me see what else we did here. Yeah, peak mentors. Okay, So we did talk about environment. I didn't totally make that part up. So we were going to focus on helping educate the community about what's available outdoors as far as recreation. Someone mentioned the storybook trail. We also, in April, Earth Day celebration, and to promote the parks and green spaces that we have, the fitness trails. And we also talked about possibly developing a map of Carter County and all the spaces that might be available. And a community garden was mentioned as well. All right, so we did the middle one. And then as far as community resources, we just wanted, there's so much going on, we wanted to make sure that we kind of had a clearinghouse where we could let everybody know what's available and provide evidence-based education to the community, ensure resources are shared. And then someone talked about making sure we host and promote food, you know, clothing, all those drives that we needed, certainly closer a little bit to the holiday area. And I think we should get our speaker to talk a little bit about peak mentors again, because that is such a need in this community. Could you get back and talk a little bit about that? This
Yes.
is yeah.
Yes, no problem. Well, what we do, you know, peak mentors, what we do, we just take at-risk youth and we match them up with a positive influence to try to break the intergenerational cycle of adversity through positive relationship with caring adults. In a nutshell, that's about what we do. You know, we're trauma-informed ACEs. You know, we want kids that are high ACEs score, trauma, low school grades. You know, not very social kids. You know, we're all trauma-informed, so we understand what kind of kids that we're looking for. We're getting out in community and we're doing we're giving away lunches and we're giving away activities to the kids. We're partnering up with Elizabethan Public Library and of course Carter County Drug Prevention Coalition. We also are affiliated with Wit and Huddle and Red Legacy Recovery as well. And the grant came from the NRPA, which is the National Recreation Parks Association, which is also provided from the Department of Justice. There was those five cities total that was taken into account for this, all in Appalachia, which is 420 counties spanning from Mississippi up to Maine, and Steubenville, Ohio, Danville, Virginia, Mount Airy, North Carolina, and Millsboro, Kentucky is the other grantees. And we are funded until September of 2022. As of right now, we was extended 1 full year more because of the pandemic that we are currently experiencing. But that's in a nutshell. That's about what we do. We just try to take kids and change their lives through positive relationships.
Thank you. Important work. Is there anyone else from our group B that would like to share? All right, Jillian, I think you're ready for the next group. Thank you.
Yes, thank you all. So I'll just add, I think this group is gonna break into more groups, as I said, and they still will need somebody to kind of own this outdoor committee and this community resources committee. So if there's anybody that's in another group and says, oh my gosh, I love that, I want to be in that committee, they're so fun, please feel free to say that today and or another day or whatever, if you feel like these are good fits for you, because they will need an owner of these other two things. And then also just be reminded that you're welcome to jump in on these things anytime as well. So even if you're a member of Committee A or Committee C, please feel free to share whatever they decide to do for Sexual Assault Awareness Month, or jump into that as well. So the goal is collaboration among all of the places, all of the sectors and committees. So
Julian,
yeah.
before you move on, I can see where some of what this committee is doing can be supported and overlap with Committee A, with the magazine and with the awareness. If you know what resources you come up with, we can put that in our magazine. If you need social media awareness for Sexual Assault Awareness Month, you can send that information over and we can help promote that through our awareness campaigns. So I can see where it can overlap some.
Thank you.
Okay. I'm gonna add that over here too. Okay, so Committee C, want to share your progress?
We had this is Tony, unless somebody else wants to give our presentation. We had 6 members. Carol joined us from Tennessee Reconnect, and Carol Patton. And we had a nice discussion about how some of our ambitious plans from the first meeting were rethought a little bit about in the context of how much stress people are under these days, which I think came up in a previous report out that COVID is changing people's perception of mental health, and things like suicide is being discussed. I know I teach at the medical school, and we're talking about how providers, all those long hours and patient contact, have to be informed about the challenges to their mental health. But it's not just physicians and nurses and EMS and the like. So anyway, we decided that our main outreach is going to be the Tennessee Together legislation and the implementation, which has to do with the youth survey. And we are going to, first of all, educate ourselves about Tennessee Together, the legislation, how it came into being, what is actually it's actually comprised of. And Jillian was so kind as to say we could get a speaker to one of our groups. And so that will have to be planned to go into one of our favorite time slots, a Wednesday or Thursday noon time slot. And this would probably be our favorite time for meeting as a committee as well, because we have sort of some ambitious plans. We went ahead and passed 3 motions. One motion is to, of course, do what we just talked about. Another is, since we were able to see what a group of public health students from ETSU did with the needs assessment for this particular project and it included basically Tennessee Together and the drug status in Carter County and the needs assessment in Carter County, and a logic model that there had been some survey information accumulated and some questions that came out of the current student population as part of the Tennessee Together Youth Survey. And so Jane Harper suggested that we might want to beef up that survey because the questions were actually included. So that was another part of our second motion. And then we had a motion to look at the upcoming Robert Wood Johnson Foundation, University of Wisconsin County Health Rankings, which have been useful to us in the past as the Health Council to look at Carter County, not in the context of within Tennessee, where we would compare ourselves to Lake County in West Tennessee with, maybe 10,000 people, or Williamson County, the wealthiest county in Tennessee, but our peers across the nation, because there are 3,000 counties plus in the United States. So why not look apples to apples? And so there are a number of comparable cohorts. And with the latest data coming out in March, we should be able to find out how our latest data will show how Carter County stacks up against approximately 35 counties, which Carter County is most comparable to. And that data will be very useful to us. We talked ultimately about the big picture, and we talked ultimately about how we need to be starting to drive this towards policymakers. One thing that didn't come up is to how we can operationalize this into some grant funding, which I think our group is sort of in the driver's seat for providing useful information for any groups that would want to try and get funding. So anybody from our group that wants to add anything that I might have missed, did I miss a motion or anything like that? But we were pretty encouraged about turning the ship around from a punitive model on substance abuse to one about it's, of course, mental health, and also wrap around provision of services and social and not just social services, but all economic help for families and individuals dealing with substance abuse issues.
Thank you so much. All right, does anybody else have anything before we wrap up? All right, I put the membership form in the chat. Please make sure you filled that out and make sure you've signed in the chat box as well. So we appreciate y'all being here, and we will see you next month.